Heart attack. What is heart attack? Heart attack is a very crucial disease process that we need to talk about at this DNA. You're welcome to another edition of my program called Health Talk with Queen Nikki. It's really alarming how people are dying of heart attack. I've done several videos to talk about heart attack in my previous video, but it's just something that I need to come back and reinforce and talked about. If you have signs and symptoms of heart attack, which is like heart palpitation, chest pain, blurry vision, confusion, things like that, please don't take it lightly, because if you have heart attack symptoms, you only have 3 hours window to do something about it. And if you don't do something about it, it can lead to death, which is pi. I'm using pi because of TikTok regulation. So yeah, it's high time we need to take it serious. I have news about people going to Nigeria with cardiac issue. They have chest pain multiple times, like weeks before their heart attack. They travel to Nigeria, and then when they got there, they end up getting heart attack, and they took them to the hospital, and they end up dying. And these are very industrious, good people. See, my cardiac let me say, my sincere advice for those people that are going to Nigeria: if you have any symptom that have to do with heart or yourself, please stay where you are, like in diaspora where you are, to treat yourself very well before you embark on journey or vacation to Nigeria or any African country where the medical system is not that good. It's for your own safety. You've worked so hard living in abroad, then finally you decided to go back home, and then you end up, getting sick, and then they take you to a hospital with high standard hospital. At the end of the day, you still lost your soul due to things like this. It is very important. Now, what are the safety measures that we need to take care of wherever we live or we are traveling abroad? Number one, get your medical record intact. If you're diabetes, there's a handband that you need to wear that will say diabetes. If you have hypertension, they have the handband you can put. If you have allergy to medication, they have it. You can just put all those information there, so that when you get to your destination of vacation, mostly Africa, they have it handy. Now, get some antidote medication, like for allergy, like Benadryl over the counter. They have it over the counter, like fever reducer like Motrin, Tylenol, cough medication, pain relief medication. If you have prescription medication for diabetes, hypertension, any disease that you have, get your doctor prescription, hold the prescription, and travel with it. Okay, travel with it. Now, if you have signs and symptoms, especially chest pain, that is not improving with exercise, rest, deep breathing exercise, stress reducer, please take it serious. Go to the nearest emergency room, let them check it out. They will do EKG, they will do advanced testing, just to make sure it's not cardiac arrest. Okay, very important. If you are above 40, well, let's say 30, because before we think those people that usually have heart attack, they are older people, but now we find out that 20-year-old, 30-year-old are having heart attack. So education is very, very important. If you are old or older, like 40 years old, and you are exhibiting these signs and symptoms, there are two major labs you need to watch out for. First, let's think about it. How is your cholesterol level? Very important. How is your A1C level, which is the one that is testing for diabetes? If you are pre-diabetes, you have diabetes, they can handle it. Now, let's talk about weight gain. In Africa, when we put on weight, we think, oh, because we are rich, that's why we are gaining weight. No. weight gain, you need to investigate it very well. Is it due to illness, or is what you're putting in your mouth that is making you to add weight? This is where you need to take care of yourself. Now, this is where the physical examination that we do every year comes in, because these are the labs that they would do to make sure they monitor your A1C, your blood sugar level, and your cholesterol level. Once it's high, they can put you on medication that can help you to reduce it. First, they will do diet modification. Diet modification in the sense that they will give you alternative of what you can eat to reduce your cholesterol level. Once it's reduced, you understand, then they can take it off further by doing further testing. Maybe they will tell you to do glucose challenge test or fasting glucose test, so that way they can be able to see your number, and then you'll be frequently going to the doctor's office, so that way they can further monitor your level to make sure it's at an ideal number that it should be. Okay, so weight management is very important, and I'm still coming back to talk about it. Once you can be able to control that, then we can now talk about high blood pressure, because all this disease process, they work hand in hand. Now, high blood pressure is number one cause of heart attack. Yes, some people walk around without even knowing that they have high blood pressure. So once you are able to identify it, that's why in every home, we need to have blood pressure machine whereby we check our blood pressure, especially if you have children too, because right now children too have high blood pressure due to stress or due to illness or emotional stress, bullying, and all those stuff. They can have high blood pressure. And high blood pressure can lead to stroke, and stroke can lead to heart attack, and heart attack can lead to death. So these are the things we need to put into consideration. Now, what are the management? Identify your body. You know your body. Once you exhibit all the signs and symptoms, take it to the next step by going to your primary care doctor so they can do further testing. Manage what you put in your mouth. Manage it. If you are older adult, consult with your doctor. There are some medication they can place you in if you have high blood pressure, if you have diabetes, and they can also put you on to exercise, healthy diet, eating, drinking a lot of water, and also stress management. Stress management, very important. Stress management. There are some things in life that you cannot change, but there are so many things in life that you can change to keep yourself healthy. This is not the matter of religion that, oh God, please help me. It's the matter of what are you doing to keep yourself safe and healthy so you don't die young. We've had so many cases where people will go and work several hours, come back home and sleep and die in their sleep due to heart attack. This is why we need to do stress management. I'll be doing a lot of yoga exercise, sample of yoga exercise here on my channel. That's why you need to stick to my channel. These are the things we'll be discussing about. I am just ranting today for our own good, including myself. I am learning as a registered nurse here in United States. The rate at which people are dying of heart attack is alarming. And please, we can do it. Stop smoking. Stop drinking alcohol. Eat right, low carb, high in protein, high in vitamin, high in nutrient. And also, if you cannot get the nutrient, there are over-the-counter multivitamin that you can take. Exercise, eat right, detox if you have to detox your system. I hope this helped. I'll be coming frequently, to talk about healthy lifestyle with Queen Nikki and life experience with Queen Nikki. I hope this helps. Keep safe, keep eating healthy, and live healthy lifestyle. Till I see you guys in my next video, follow this button, Health Talk Queen on TikTok, and Health Talk Queen 1 on YouTube, and Health Talk Queen on Instagram. Take care, and God bless you guys.